the show today, it is anovulation and how it affects the fertility. Let me not be the one to explain what anovulation is. I am not the expert. We have the experts in the house. This fantastic day, Dr. Kunle Ajayi is here with us again after staying away for about 4 weeks from the show. Dr. Kunle, it's so good to have you join us on the show today.
Thank you very much, David. Yeah. It's always a pleasure.
Always a pleasure. Dr. Kunle Ajayi is an obstetric and gynecologist and a reproductive medicine expert. Waiting to know what anovulation really means. Let's start with that.
Thank you very much, David. Anovulation actually refers to a condition where a woman does not ovulate. Okay? So I will first start by explaining what ovulation is. And ovulation just means release of eggs from the ovaries, every month or every cycle. And the this process is actually, controlled by several hormones.
Yeah.
Those hormones start from the brain, and they come down to the neck, that's the thyroid, and then sometimes they go down also to the ovaries. Okay, so if there's any problem along that pathway, then a woman might not ovulate. Okay, and I mean, ovulation is a woman thing, and what it just means, like I said, is release of eggs. The eggs have to be released, and once they are released, the expectation is that they will unite with the male gamete, which is the sperm, and then ultimately lead to pregnancy. Okay, so when a woman does not ovulate, of course, that's an ovulation. And an ovulation is actually
the opposite of ovulation.
The opposite of not ovulating, the absence of ovulation. Yes. Yeah, and it can lead to infertility.
What are the risk factors of anovulation?
So, I told you that the process of ovulation is guided by hormones.
Yes.
So, if the hormones that should be causing ovulation are not there for any reason,
or they're dormant.
Yeah, just dormant. Then there will be no ovulation. Then there are some other conditions also that will make you not ovulate. For example, if you lose weight too drastically, to something they call anorexia nervosa, or if you gain weight too rapidly, those kind of things may put you at risk. Some drugs, especially if you take hormonal contraceptives, they can actually also lead to anovulation. You understand?
Yeah.
So if a woman is taking those drugs to prevent pregnancy, of course she will not ovulate. Try this, combine those oral contraceptive pills.
Yeah.
Postinol that everybody takes
frequently.
It's the main job is actually to prevent ovulation. So that kind of thing can actually lead to anovulation. And then there is if you have thyroid dysfunction, the thyroid gland is in the neck. If the thyroid produces too much hormone or it produces too little hormone, it can lead to not ovulating. There's a condition called PCOS, polycystic ovarian. So we'll discuss that later. It could lead to it. Some people are actually born with conditions that make it impossible to ovulate. There's something called Turner syndrome, where the ovaries don't develop the way they should. They just form as streaks. So
what could be responsible for that?
It's genetic. Turner syndrome is a condition where the chromosomal number, instead of being 46, is 45.
Wow.
So, and then some people are even born 47XXY, 48. So it's in fact, medicine is when we talk about congenital anomalies, we can spend all day talking about all those things.
Wow.
And then of course the ovaries could decide to fail. It could fail in natural menopause from 45 to 55, for example. But the ovaries could also fail before 40 years. And that's what they call premature ovarian failure or primary ovarian insufficiency. So all those kind of things may lead to somebody not ovulate. So there will be signs, of course, and then there may be symptoms.
Okay.
So some of the signs could be, of course, like I said, excessive weight loss, person has lost a lot of weight.
Drastic weight loss. Yeah.
You know, a person could also be obese. But the most common causes would be a woman who doesn't menstruate regularly. So she has irregular menstruation. So one of the things that we know is that a woman who menstruates normally most likely also ovulates regularly. So ovulation is, you know, how will I say, one of the hallmarks.
Menstruation.
Yes. Regular menstruation is a sign of regular ovulation. So let's put it that way.
Okay.
So if this one is not ovulating, she might not see her menses, or it doesn't come regularly. Then even if it comes, it can be scanty. It can even be excessive.
Wow.
You know, and then of course the signs of ovulation will not be there. You know, when a woman, some of these women have ways of checking themselves. So, for example, the nipple tenderness that comes here with ovulation might not be there. The what's it called? The changes in the cervical mucus that when women check, when it's stretchy, those things will not be there. And then sometimes it could just be that she's trying to get pregnant. So infertility is trying to. Even she might even be seeing the period regularly, but she's probably not ovulating because the eggs are there, but they are not being released. Something called the luteinized unruptured follicle. It's also
I know why you're laughing. You don't want to bother me with those medical terms.
So even the woman who is seeing her period regularly sometimes may not even be ovulating, but it's only when she's now trying to have babies that will now do
realize
tests.
and say that.
And then there's also this thing called high prolactin, where the woman releases, she brings out milk from the breast even when she's not pregnant.
Pregnant?
Yes.
What do you call that?
It's called galactoria. That's releasing milk from the breast. But most times it's due to high levels of prolactin, which is one of the hormones that we say is produced in the brain. So high levels will disrupt the hormonal balance of the body, and the woman ends up not ovulating because all the way the hormone should be released, the hormone is not being released.
The sequence has been scattered.
Because they call it a pulsatile release.
Yes.
It comes every 90 minutes. And then prolactin just comes and disrupts that. Once that pulsatility is lost, then that could also...
How can this disorder be treated? I'm sure everybody's waiting to know how this can be balanced. This hormonal imbalance can be balanced. Yes.
Like I said earlier, the treatment is based on whatever is causing it. And then I told you that there could be so many things that could, be leading to it. But the most important would be maintaining an ideal weight. So don't exercise too excessively to the point that you are very, very skinny, and then don't try to gain too much weight, because too much weight also could affect the hormonal balance and then lead to something called PCOS. I'm going to discuss that later.
Yeah.
Okay, so maintaining a good weight is one of those things. And a lot of our women are now trying to be more curvy. They're taking medications.
Medications for different reasons, different parts of the body.
Yeah. And sometimes some of these medications can alter your hormonal balance, and you may become very curvy, but end up, having fertility issues because you are not ovulating.
Thank you, Dafe. I just listened to your radio and you get the response.
Okay. Thank you very much, Dafe, for your question. Many of these pills that we use nowadays, they are supposed to prevent ovulation and in by extension pregnancy for a short period of time. So they are short acting but very, very reversible. Okay. So while you're on the medications, they are expected to be highly effective in preventing ovulation as well as pregnancy. But the moment you go off those medications, we expect that your wife's body should get back to normal, and then she starts producing eggs again, as long as she's still within the reproductive age. Those drugs don't have a permanent effect on prevention ovulation. Their effects are very short term. The ones that may give you long term, what's it called, impacts are even, there are things like the injectables, those injections that they use to prevent pregnancies, or the implants, the ones they put under the arm. But the good thing about those drugs also is that even though they are long acting, they are also very reversible. So the effect on ovulation are very, very temporary.
Minimal, yes.
It helps you then even produce milk that is going to eventually feed the baby. So prolactin levels are very, very high in pregnancy. So nobody will go and be measuring prolactin levels when you're pregnant. About the ovaries, they are not properly formed, or where the what's it called, they fail too early, like before the woman is even 40 years old. In such instances, that's where people like us come in, where we know that she cannot produce any egg, or she can get donor eggs for them. We get people who have healthy eggs, they donate those eggs, and those eggs are fertilized by their partner's sperms, and then will now, through IVF, they're able to achieve pregnancy. So for everything that we've talked about, there is a solution.
Fantastic, Lagos. Could this be a wrong approach to it? Some people say it's a sign of a disease or an infection. Talking about anovulation, could this be it? Before you respond, we have a caller on infection. Yes, that was where you were.
Well, I can't think of any disease particularly that would lead to anovulation. But sometimes, if there's chronic pelvic infection, where adhesions or where the organs have been matted together because of the infection, the eggs might find it difficult to pop out of the ovaries because the ovaries have been encased, in those adhesions. So if you have that kind of situation, yes, it's possible, and that's a sequelae of chronic PID, they call pelvic inflammatory disease. It's not as common as it used to be, but it's still there.
I
Healthy body weight. If you know what your BMI is
that the benchmark? Is the BMI the benchmark for healthy body weight?
Well, it's not the only thing, but at least it's a good way to start.
Yes.
There's a lot of controversy concerning BMI
because this is what I'm asking. I check my BMI oftentimes, and they tell me I'm overweight. Tell me I'm tending towards being obese.
But David, you're tall.
Yes.
And then you are also huge. So not only a weightlifter. Weightlifters, BMIs don't work for people like that. People that are in sports, BMI will not be
work for them.
It won't work for them. So we won't use that.
Okay.
I'll be more concerned about lean muscle and what they call this lean body weight. Know what your fat to muscle ratio is. Those are the kind of things that will work for people like you.
Fantastic.
So like I was talking
about treatment,
ideal weight. Then if it is due to the disorder, that PCOS I mentioned about polycystic ovarian syndrome, that one to weight loss will help, but there are medications that we use to induce ovulation in those people. And I'm sure a lot of women would have come across many of them. They talk about Clomid, they talk about different things. So many of those drugs, if used the right way, especially when you've made the diagnosis, you are likely to be able to solve the problem of polycystic ovarian syndrome. It's easy to treat, but once you've done weight, you've done that. The other things might be injections and other things, but we might not even need to get to that point before the syndrome is treated. If it is increased prolactin levels, like I mentioned before, where the woman is bringing out milk from the breast, all we have to do is just
when she's not pregnant.
When she's not pregnant, the normal thing would be to give her medications to reduce that prolactin.
The release of that hormone.
Yes, so just give her, because what happens is that there is something in the brain called dopamine that should be inhibiting the release of prolactin. So the dopamine levels are low, prolactin levels will be high. And there are some drugs that are even lit. So what we now do is give you medications that act like dopamine to bring down prolactin levels.
So what happens when a woman is pregnant? The prolactin level goes up. It's
very, very high. And that is why women who are pregnant don't ovulate.
Fantastic. Fantastic.